All right, welcome again, everybody. This is Group Nine's presentation on Hippa. We've got Melanie, Toa, Denise, Danielle, and then Bernadette. So I'll go ahead and turn the time on over to you ladies, and away you go.
All right, thank you, Brother Gage. Like he said, this is Group 9. We are discussing HIPAA this evening. And next slide, please. HIPAA is the Health Insurance Portability and Accountability Act of 1996. It's a United States legislation that provides data privacy and security provisions for safeguarding medical information. HIPAA also protects health insurance coverage for workers and their families when they change or lose their jobs, and that's called portability, which we'll discuss later in the presentation. HIPAA also protects health data integrity, confidentiality, and availability, and that's what we call accountability, which will be discussed later in the presentation also. HIPAA was enacted in Congress and signed by President Bill Clinton in 1996. Next slide, please. The main purposes of HIPAA are to help consumers maintain their insurance coverage, but it includes a separate set of provisions called the administrative simplifications. HIPAA also provides electronic and physical security of personal and health information. HIPAA also protects the privacy of a client's personal and health information. HIPAA also allows individuals to make complaints and have them documented with their outcomes. Next slide, please. Some of the other basic information that about HIPAA is who enforces it. It says who enforces the health information privacy and security standards established under HIPAA. That is the Office for Civil Rights, the Office of eHealth Standards and Services, and the Centers of Medicare and Medicaid Services. Who is affected by HIPAA? They're the health plans, healthcare clearinghouses, and healthcare providers that electronically transmit health information in connection with standard transactions. Next slide.
Okay, so the importance of patient privacy. This is a national requirement in doctors' offices, hospitals, or individual businesses. Each doctor's office, hospitals, or businesses, each is required to have the appropriate safeguards for patient and client information. It sets limits and conditions on the uses and disclosures that may be made without patient authorization. It also gives patients the right over their own information, which means that patients can view their own information, they can request for changes to be made if something is incorrect, and patients can obtain a copy of their records. The HIPAA privacy rule was made to protect patient information and data and medical records. It, like we said earlier, is a national standard or requirement in all facilities. It also allows it gives patients the rule of the right over their own health information, and this includes to examine their medical records as well. Next slide, please. Okay. So there are different violations of HIPAAs. One is a violation of breach. That means that this is impermissible, which means they're not allowed use or disclosure under the privacy rule that compromises the security or privacy of the protected health information of the patient. This allows the following entities are those that need to be notified in the event of a breach of privacy: individual notice, And an example of an individual notice would be the individuals that their information has been breached. They need to let all of these patients or these employees know if any of their information has been disclosed. Media notice. But this is another example of the covered entities affecting more than 500 residents of a state or jurisdiction. They need to be notified through the media so that they can be aware of their information being breached. Notice to the secretary. This is, in addition to notifying affected individuals and the media where appropriate, cover entities must notify the secretary of breaches of unsecured protected health information. The secretary can go to the HHS website and fill out a report form of a breach. Another one is notice to the secretary, and this notification by a business associate, and this is that the business or the business associate must be covered by the discovery of the breach. And then administrative requirements and burden of proof. This means that the burden of demonstrating that all notifications have been provided or that a use or disclosure of unsecured protected health information did not constitute a breach. So all facilities and businesses need to cover themselves. And this is one of the ways that they can do it as well. Next slide, please. And these are some of the consequences of a HIPAA violation. They include fines, and as you can see that there are different types of fines. And the first one is the individual didn't know they violated HIPAA, and the fine is between $100,000 to $50,000. And then if, let's say, you have multiple violations, you could receive a fine up to $1.5 million. And then it goes on to reasonable cause and not willful neglect. And there are the fines, and willful neglect but corrected within time. And those are the fines that are the consequences of that as well. And then willful neglect and is not corrected, and those are the fines as well. So as you can see that there is, if a violation has been made, a form needs to be filled out that is documenting the patient or the violation of HIPAA standards. And so there are consequences for violating HIPAA. So it's really important. Next slide, please. And then there are other types of violations like unencrypted data, employee error, and data stored on devices, business associates, and lapse in notification. And unencrypted data is, a little note here. Unencrypted data is breaches that have not been reported. The vast majority of data breaches are due to stolen or lost data that was unencrypted. A common theme includes data archiving method or using backup tapes to store patient health records. And one way that you can eliminate this is by eliminating the backup tape. Cloud disaster recovery can increase recovery time objects and restore your server data and application in hours if you do not have a tape backup. Employee error is basically what it says, where employee hasn't taken all the proper precautions. Their training is not appropriate. They haven't had the proper training. So that's important. Data stored on devices is there's a possibility of theft, and that's a type of violation for HIPAA as well. And business associates, it says 62% of data breaches involved a business associate. And this is independent of HIPAA auto report for verification of that HIPAA hosting provider can actually provide compliant solutions and a compliant hosting environment that can withstand scrutiny by an auditor measuring against audit protocol. So this is just saying that business associates need to know the responsibilities and ownership and timeline of the breach notification and how they handle it. And then lapse notification is where there's been a violation but hasn't been reported in time. And the proper steps need to be taken in order to keep that violation from happening, and the proper training as well. Next slide, please.
Okay, so the Health Insurance Portability and Accountability Act of 1996, HIPAA, provides rights and protections for participants in a group health plan. HIPAA states that employer health insurance plans may not be able to exclude coverage for pre-existing conditions, provides opportunities to enroll in a group health plan if either coverage is lost or certain life events occur, prohibits discrimination against employees and their dependent family members based on health factors, and assures that certain people will have access to and can renew individual health insurance policies. Next slide, please.
So for the portability, it's asking, like, what does portability cover? And so one of the main things it talks about is that it limits exclusions for pre-existing conditions. Other health insurance, other organizations that you go to will tell the individuals that they are not eligible, they're not able to have that certain coverage because they've had a certain health condition that has existed. But for portability, when it's talking about a pre-existing condition, that is not a factor that will eliminate you from the health coverage. The second point is no discrimination based on your health status. Again, it's like a reminder of a pre-existing condition. And individuals are able to enroll for special circumstances. And we'll get more into that later in the PowerPoint. And then the last point is the option of purchasing a new coverage if no health plan is available. So next slide, please. So can we lose this coverage? An individual may lose coverage based on the following information. So one, if they are divorced or separated. Two, if the dependent is no longer covered on a parent's plan. Three, if a death of a spouse, like they leave you without any coverage. Or if a spouse's employment ends. Reduction of employment hours, which is not covered by a health plan. If a health plan decides not to cover for a specific population of people, and an example would be like part-time employees. Okay, next slide, please. Can we be denied coverage? So under HIPAA, individuals cannot be denied coverage for the following health factors. So if there was a health status, a medical condition, claims experience, receiving health care, medical history, genetic information. So those are things that you can have, but you can't be eliminated if based on those factors there. Okay, so next slide, please.
Okay, what is COBRA? COBRA stands for the Consolidated Omnibus Budget Reconciliation Act. It gives workers and their families who lose their health benefits the right to choose to continue group health benefits provided by their group health plan for limited periods of time under certain circumstances, such as voluntary or involuntary job loss, reduction in the hours worked, transition between jobs, death, divorce, and other life events. Qualified individuals may be required to pay the entire premium for coverage up to 102% of the cost to the plan. Next slide, please. COBRA generally requires that group health plans sponsored by employees with 20 or more employees in the prior year offer employees and their families the opportunity for a temporary extension of health coverage called continuation coverage in certain instances where coverages under the plan would otherwise end. COBRA outlines how employees and family members may elect continuation coverage. It also requires employers and plans to provide notice. Next slide, please.
Okay, so this part of COBRA talks about like the costs and coverages of COBRA. And COBRA is temporary, and it's the people that have to pay for the full cost plus 2% of the administrative charge. And so usually it's more expensive to pay for like the COBRA versus just the group health plan. So this picture on the right side, it's showing some examples of events, for example, termination of reduction in hours of employment. And so that coverage under COBRA would last an additional 18 months. And then the other examples, employee enrollment in Medicare, again, that coverage will last for an additional 36 months. And so you can keep looking at that chart, and it shows other examples of divorce or legal separation, death of employee, loss of dependent child status under the plan. And just depending on those events, you'll have the correlating maximum period of coverage. And so COBRA, it applies to group health plans, private sector, state or local governments, but it's not applicable to plans sponsored by the federal governments or church. So next slide, please. Okay, and so lastly, what is special enrollment opportunities? This is like an alternative to COBRA under Hippa, and it's for individuals who were previously rejected health coverage, but they may be able to enroll. And so there's two different types. There's one, if they're declined coverage based on other health coverage and then lose eligibility. So, for example, if there's a family and then there's like the wife, and like they are given health insurance coverage, but she turns it down because her husband has health insurance. But then years later, the husband passes away, and then the family decides, oh, okay, we do need to take advantage. We do need help from that insurance. So that's just an example of how COBRA would come in handy under HIPAA. And then the second example is just based on marriage, birth, or adoption. And the enrollment just needs to be requested within 30 days of loss. So next slide, please. These are just slides of our references. And then next slide. And again, it's continued. And next slide. So that's the end of our presentation. We hope that all of you enjoyed watching and that you're able to understand it. We apologize because we noticed some of the pictures were kind of covering the words, but I noticed that Brother Gage kind of helped move them down so you're able to see it. So that's the end of our presentation, so thank you for watching.
Okay, very good. You ready for a couple questions?
Sure.
Okay.
Sure.
One of the things that I kind of joke about within working in healthcare is I say if you ever want to get fired, there's a couple things you can do on the job to get fired. One is look at porn, and two is violate HIPAA violations. Because I happen to know I happen to know someone who's done both, or multiple people who've done both, and they got fired very quickly. So that's one thing I joke about. But why do you think HIPAA is weighed so heavily as far as importance goes within healthcare for healthcare employees? And we're talking, of course, about the privacy section of HIPAA.
I think personally because you're dealing with medical information. I mean, it's privacy. It's personal information. It's be safeguarded.
Yeah, Sorry, you're breaking up a little bit, but I think I got the gist of it. That you're dealing with people's personal information, their privacy. Is that what you were saying?
Yes,
Oh.
yes.
Yeah, I think that's exactly right. Is one thing you'll find is a patient's privacy is one of the key things that you need to be very aware of, whether you're in public health or healthcare administration. And HIPAA is kind of what kind of plays into that. So the majority of the time when you hear HIPAA, you think of the privacy thing, which you guys covered very well, and then also the portability thing. You know, for you as the employee, if you quit, get terminated, whatever, what's the rules that go along with that? Um, I forget which slide it was. One of you had mentioned things where you breach HIPAA violations, and the term was willful neglect a couple times. Why don't you explain to me what willful neglect is?
I think it's where you know that you may not have done something exactly the way you were trained to, but it says but corrected within time. So I feel like you've neglected to cross your T's and dot your I's, but you've corrected it within the time, or you didn't cross your T's and you didn't cross your I or dot your I's, and you didn't correct it in time. You just kind of left it hanging. I think it's where you know you didn't take that extra step, and you knew you should have.
Good. Just the analogy I was thinking of as you were explaining and talking about that, Danielle, is it's almost as though you're someone who breaks a law without necessarily knowing that there was a law to be broken, but you should know. You know, we're U.S. citizens, or a lot of us are U.S. citizens. It's a part of our responsibility to know what laws there are, and so we have that responsibility. If we break that law, then we can be in trouble for it. So as a result of that, so willful neglect I think falls into what you were saying there, where you do, if we tie it to the gospel a little bit, we've got sins of commission, sins of omission, things that you did wrong, which would be a sin, things that you didn't do, which would also be wrong as well. Willful neglect kind of falls into that category where you knowingly did something, or did or didn't do something, almost out of laziness, you would think. So, good. I think that's it. I think I picked on you enough. Is there anything you ladies would like to add before I let you go?
No.
No.
Okay, very well done. You did a lot of great work in a very short amount of time, so I appreciate your hard work on that, and you should be applauded for it. So very good.
Thank you.
Thank you.
You're welcome. Have a great rest of the evening, ladies.
You too.
You too.
Okay, bye-bye.
Bye.
Bye.